During the World Health Organization meeting being held in Islamabad, Pakistan, we were honored to have with us on the program His Excellency, the Minister of Health of Oman. Your Excellency, it's a pleasure to have you. Oman has done a lot, especially in the field of non-communicable diseases. How did this come about? Why did you prioritize non-communicable diseases?
Thank you very much for having me in the program, firstly, and I'm delighted to be here for the 64th session of our Regional Office Assembly in Islamabad. Oman Healthcare started in 1970, and initially the concentration was on eradicating infectious diseases which were killing the majority of our public. Luckily, with the hard work and dedication of my predecessors, we've reached a stage of vaccination rate more than 99%.
Wow, 99%.
More than 99%. The infectious diseases became almost the story of the past.
And now?
And now, of course, in the region, and Oman is part of the region, the non-communicable diseases, unfortunately, are the commonest reason for hospital admission, death, disabilities.
I just want to explain that when we talk about non-communicable diseases, we mean heart diseases, hypertension, cancer, respiratory disorders, and mental health disorders.
Just for the viewers, I will talk about one part of our region, the Gulf Cooperation Council countries. Individuals in these countries die 10 years younger than their counterparts in Europe and America from heart disease. We are unfortunately in this region, we are the leading in diabetes in the Gulf countries,
and to be proud
of. The Gulf countries in particular, the rate between 16 and 25% of the public are diabetic. Of course, diabetes leads to complications in renal failure, cardiac, and what have you. Same with heart disease, same with which is including hypertension. Cancer, unfortunately, also in the increase. Of course, I don't want to alarm people. It's in the increase for many factors. One of them, we are aging now. We used to die very young. We live longer. But also, unfortunately, other factors like environmental factors. And what I want to stress and state that these non-communicable diseases are preventable. We can prevent more than 40% of these diseases by modifying our lifestyle. Unfortunately, the smoking rate in the region is very high. Not in Oman, luckily. It's less than 12%.
That's good, but in the rest of the region,
it's very high. Lack of physical activities is also very high. Poor diet, and I don't mean by poor diet because people cannot afford it. It's in both rich and poor countries. It's the choice of diet. So it is
a mixture of a lot of
factors. What I'm trying to say about NCD or non-communicable diseases, the governments, the health providers, their role is to have the facilities available for diagnosis, for treatment. But the most important role is the individual.
So do you have a lot of health awareness programs going on?
Absolutely. In Oman, we have a program called in Arabic, Afhas Watma'in, i.e. Have the screening to
check yourself up and be reassured.
Be reassured. And that's everybody who is 40 years or over. They can walk in any health center and they have their blood
ask for a checkup, complete
checkup for NCDs completely, and they get the result within less than a week.
That's wonderful.
We started also screening for different type of cancers, including breast cancer. We significantly improve the program for prevention of NCD, which is the base for it, is our very well-structured primary health care. The strength of health system in Oman, I'm a hospital-based clinician, but I am a great believer in primary health care and
preventive medicine.
Preventive medicine. So that's where the strength is.
I think, of course, it seems like it's a dream to be in Oman, to be checked up like this within a few days to get the result. But Oman is a relatively not densely populated nation. What would you give as advice to countries like Egypt, like Pakistan, like Iran, who have a vast population? How would they start? I mean,
I think in healthcare, what we need to definitely adopt and do is not to think about the most expensive, sophisticated machineries.
Yes.
We need to go to the basic, and the basics is the primary healthcare, which should be accessible, affordable, and equitable as well. And that is in most of our region. That should be the basis for all healthcare intervention. I can tell you in Oman, which is probably should be a model, 85% of our patients attend the primary health care.
We're seeing that more and more in countries of the Gulf, of course, Oman being the lead on that, because
you spoke about countries which are with limited resources, yet we spend about 15% only on primary health care. So they cater for 85% of the health service, spend about 15 to 20%. And I'm glad to say that the countries in the region, the majority, if not all of them, are following the same pattern, i.e. primary health care. And this, of course, doesn't mean we don't need hospitals.
Of course, we always
do
will.
For complicated cases, and as we've mentioned previously, because we are, alhamdulillah, aging, we live longer. Of course, life, toward the end of it, it comes with
quality of life is important.
It's important. So the only message for my colleagues in the healthcare system, the concentration on primary health care, the concentration on prevention, also involving the other sectors. NCDs are not only related to ministries of health. It is everybody's business.
So the private sector as well has to be involved.
Private sector, other government sectors, it starts from the house, from the family unit, school, working place, everywhere.
Thank you so much, Your Excellency. I have just one last question. Sure. Did you have to allocate more health in the general government budget, more money in the general budget to health and education in Oman? What percentage was given to that?
As a Ministry of Health, we don't have like sets of budgets for each program, but we have the prevention program started in the 70s, and they are getting better and better, and we are utilizing the media by all its types, the social media. We are also, as I said, involving the communities. Oman, as you said, population-wise, we are just about 4.5 million, but area-wise, it's huge, and it's divided into small provinces. And in each wilaya, called wilaya, there is a health committee, which is actually volunteers, and they go to people's houses, they go to places.
It sounds like the Garden of Eden. We'll all be coming to Oman.
Thank you very much. You're
Thank
more
you
than
so
welcome.
much, Your
Thank
Excellency.
you. Pleasure.
Thank you.
And best of luck for the rest of the meeting.
Thank you so much for meeting with His Excellency, the Minister of Health of Oman. And now we know where to go for non-communicable diseases in particular, and many more.